Hello, welcome to Hazel Health, an overview for school staff. My name is Kate Owens, and I will be facilitating today. Here's our agenda. I'm going to explain what is Hazel Health, how does Hazel work, and how do families sign up for our services. So let's start with who is Hazel. We are the largest, most trusted school-centered telehealth provider. We will provide the students in Miami-Dade with mental health teletherapy available at home and at school, and on-demand urgent care, which is physical health teletherapy at home or at school. Our staff of providers specialize in working with school-age children. Now, what is telehealth? Telehealth is the use of technology to provide healthcare virtually. This makes it easier for us to meet students' needs because we meet them where the students are. We have partnered with over 300 school districts and we serve over 50 million students. And there's Miami-Dade. What are the benefits of our partnership with Hazel? How is this going to help you, your students, and your families? First, our services are at no out-of-pocket cost for your families, whether they have insurance or not. That partnership makes it possible for your students to get care with no out-of-pocket cost for any family. How does it benefit you? Students get back to class faster. Hazel's model makes it possible for students to get the mental health and physical health care in school and at home, reducing absenteeism, which helps reduce the need for makeup work. We provide care for all students. Hazel Health providers provide that same high quality care for students with insurance, without insurance, and regardless of their immigration status. Parents will never receive a bill for Hazel services. Here shows on the left some of the reasons why students and parents access our physical health services. On the right, you see some of the ways we can help your students with their mental health concerns. Our physical health services and mental health services will be available at school during school hours, and our mental health services are available at home from 7 a.m. to 7 p.m., Monday through Friday, and our physical health services are available at home from 7 a.m. to 5 p.m., Monday through Friday. You know your kids best. Hazel is a great fit when students are struggling. We fit into every single stage of your MTSS structure, and you are at the front lines because you have the children in your class. When you notice a sudden behavioral change in a child, maybe that child was part of the school community, had a wide circle of friends, and now they're self-isolating. Well, that's a red flag. You can bring that child to the attention of your student wellness support team, and they can refer that child to Hazel to get the support they need. Hazel also supports students' social well-being, resilience, and mental health literacy. We provide individualized interventions for students struggling with social emotional competencies and executive functioning, life skills. Here's a summary of our impact on physical health. 28% of families who would have had to go to the ER or urgent care if Hazel was not available. We provide an average wait time of 12 minutes for at-school physical health visits, much shorter than the ER or urgent care. And 66% of our visits result in health education, education for parents and guardians, and education for the student. Now, this slide demonstrates some of the barriers for students getting care and how Hazel is uniquely addressing these barriers. First, parents not seeing the signs. A student is struggling with mental health care. Sometimes that can be difficult to identify. School staff members can refer students to their student wellness support team for mental health services for that child. If the parents lack insurance or healthcare system savviness, our services are provided at no out-of-pocket cost to families. There is a stigma around mental health and teletherapy in general. We have a skilled team of family resource managers and enrollment coordinators to guide families. Appointment logistics can be difficult for parents getting time off work and providing transportation. Our services are provided at home and at school with the ability for parents and guardians to join any one of our sessions virtually from wherever they are. There are wait lists for services, and it is difficult getting a same day doctor's appointment. At Hazel here, we are focused on the capacity to support shorter wait lists and other options in the community, and we provide that on-demand physical health telemedicine. How do parents get access to our services? First, parents must sign in to the parent portal and give permission to share their student basic demographic information with Hazel. Without the basic demographic information, students cannot be referred to service or access our physical health services either. So parents first have to agree to share their data with Hazel. After a wait of 2 days, that student data will appear in our Hazel app. At that time, parents can complete the consent to care form, create their Hazel accounts, and request services for their students. This is what the consent form will look like. It is available at Miami-Dade Public Schools website. On the consent form, we gather basic student health information. On the consent form, there is also a place for parents to provide their insurance information with 2 different ways of capturing that insurance, either by photograph or by them manually typing the information in. But what if your parents don't have insurance? Right here is a place for them to indicate they do not have medical insurance. And guess what? They still have access at no out-of-pocket cost. We can help you in communicating about this wonderful resource for your families. There is a QR box on the upper right-hand side that will take you directly to resources. It is a Google folder full of classroom resources like the posters you see here, or ready-to-go letters to let parents know about the service. We are again super excited about the work we're doing with Miami-Dade Public Schools and to help you with the most important job of meeting the needs of students. Thank you so much for your time. Have a great rest of the day.